Okay, so for everyone that's going to be watching this, good morning and welcome. Today we are talking about one of the most urgent issues that are facing South Africa, the well-being of our youngest children and the collective responsibility that we carry to secure their future. And I'm joined by David Harrison, CEO of the DG Murray Trust, which is one of South Africa's leading philanthropic organizations focused on innovation, inclusion, and long-term social change. David, you've spent decades working at the intersection of public health, education, and social development. And the DG Murray Trust conceptualized and developed the national Hold My Hand campaign, a movement calling on all sectors of society to step up for young children. Thank you for joining me today, David.
Thanks, Vanessa. It's a pleasure.
So before we talk about the campaign itself, let's talk about the real state of young children in South Africa right now. And maybe for people who haven't necessarily been following the data closely, what is the current reality for young children in South Africa?
Well, over the past 30 years, we've definitely made progress. We've definitely seen declines in child mortality rate. We've seen declines in acute malnutrition. We've seen higher rates of participation in schooling. So that's been positive. But over the last 5 years, we've seen some troubling signs. We've seen that it appears that reductions in child deaths have in fact started to reverse. We know the challenge of having children in school, but really still not producing education outcomes that we expect. So clearly, children are not able to learn as well as they should. And then the most intractable problem for children, I would say, and this is obviously apart from the acute issues of violence and trauma in their lives, but the most intractable long-term problem we have in the country is that we have not addressed chronic malnutrition. Our children are chronically stunted, they get enough pap, they don't get enough protein, and this is a pattern that has consistently proceeded over the past 30 to 35 years. Slight declines, but certainly nothing to write home about. And so the concern we have now is that if we keep on this path with the pattern that I've described, we're probably going to start going downhill again. It's only if we confront these realities, confront and understand those inflection points, find a way to radically address issues of child nutrition, that we can hopefully get on an upward trajectory in this country. And that requires us to accelerate action.
Hmm. And tell us a little bit about how poverty, malnutrition, and early learning gaps would show up later in a child's life.
Yeah, I mean, just to think about the consequences of poverty, and let me describe three consequences that result in poor in learning deficits, and the first is just the the absolute absence of nutritious foods that pregnant women and then babies who weaned onto low protein diets suffer from. So the first challenge is the absolute is the lack of nutritious of nutritious food. The second is the environment in which those children are living in. And we know that children who, and this is work that's been recently done by the University of Stellenbosch, but we know that children who are living on dirt heaps, children who are living in communities where there's extensive failure to collect waste, obviously sewage and other elements. We know that those children also have chronic infections, they develop leaky guts, they can't absorb food, and that's the second factor that plays out. And the third that we must put on the table is the association between poverty and marginalization and high rates of alcohol abuse. And we've got to address that as well. A child, a fetus at 1 month of age is the size of a grain of rice, and yet if a mom takes a glass of wine at that time, just at that most critical point of the child's life, that child can be affected for life. So we know that zero alcohol is an absolute requirement in any pregnancy. But these children are living in communities where there's just a very, very high rate of alcohol abuse. So those are three factors: absolute malnutrition, exposure to infections, exposure to toxins that have profound effects on a child's learning ability, their school outcomes, and obviously, ultimately, their ability to participate in our economy.
Mm. And if we do nothing different in the next 5 years, what will the consequences be for South Africa? You mentioned learning deficits for children. You mentioned the economy now. Maybe you could just share a bit more about consequences for the long term.
Yeah, so I think the consequences over the next 5 to 10 years of doing nothing is that we're going to simply perpetuate these patterns of exclusion. And I suspect that we won't do much worse in terms of our children's nutritional status, but we won't do any better. And the problem is that we're living on borrowed time. That these patterns of inequality in our country that have resulted in the persistent marginalization of such a significant proportion of our population is unsustainable. It can't carry on like that. So we're going to continue to see a divergence between the haves and the have-nots. We're going to see an increase in social unrest, and I would not be surprised if we don't see food riots before the 2029 elections, because issues of food are becoming more and more pronounced in people of hunger are becoming more and more pronounced in people's lives again. And so I think that's the pattern. I think it's sort of like a chronic underperformance coupled with a fragility, a heightened susceptibility to social unrest, and the profound consequences that can have.
Mm. So what you're saying is it's not just a social issue, it's actually an economic and a national stability issue.
I mean, the World Bank took them a while, but 20 years ago, they came to realize is that if you don't feed children properly, your economy doesn't grow properly. You don't have a society, you don't have a society that profits. And I'm not talking only about economic profit. I'm talking about social stability. I'm talking about well-being, health, educational outcomes. So the World Health the World Bank has sort of foregrounded issues of nutritional stunting, chronic malnutrition, as one of the absolute key ingredients to economic development and sustainability over time. And so if you have a look at South Africa's position on the Human Capital Index, which is really their measure of these are the core human capital ingredients that give rise to economic productivity over time. South Africa is sitting at about zero point 0.44, which means that children in South Africa have a 44% chance of reaching their full economic potential. 44%. And the two main factors driving that, they say, one, the underperformance of our education system, so that while our children sit in the education system for over 11 years, their actual learning outcome is equivalent to 6 years of schooling. So that's the first thing. The second is a stunting rate of 25, 26, 27%, 1 in 4 children. And of course, stunting is affecting the educational outcomes as well. So the World Bank, hard-nosed economists, with all of their baggage, they say this is an issue that needs to be addressed. And yet, a country like South Africa, great constitution, commitments to nutrition for all, 30 years on, we've not confronted the most basic ingredients, not only for child well-being, but actually for economic productivity and the means to reducing inequality over time in the country.
Mm. Thank you for giving us a bit of the lay of the land and for some of those really shocking statistics. I'd like to dive into a little bit about what's been done about this. And one of the things that the DG Murray Trust has been involved in is the Hold My Hand campaign. So could you share with us a little bit about what the campaign is all about and why was it launched now?
Yeah, about 3 years ago, we approached the presidency and said, look, if you have a look at countries that have made progress for children, and there are countries that have, Brazil, Chile, Mexico, obviously some of the developed countries that have really managed to address stunting, that have developed a national coalition for children. It's really, there are three key features when you look at those countries. One, clear presidential leadership. The president has to take this issue seriously. And it's amazing in Latin American countries, if the presidential candidates don't put issues of food on their agenda, they're very unlikely to get appointed, to get voted into power. It's a major political issue there. So that's the first thing, presidential leadership. The second is the need to really galvanize all of society in support of children. Really recognizing that services are critical, health services are critical, school services are critical, but for most of a child's life, they're in the home. That's where the vulnerability and that's where the potential to protect and to develop a child is. Now, clearly, government can't do all of that. Government can put in place an enabling framework, but it requires community-based organizations, civil society, engagement with the business sector, and families to take responsibility. So a massive program of mobilization is needed. And the third is you need an energy. You need a driver behind this national program. It doesn't have to be based within government, but somebody's really, really working on it. So presidential leadership, national program of action, often branded. So Chile's Creco Contiga, Brazil's Bolsa Familia, and then this driver. And so we said to the presidency, and they were very receptive, let's try and move towards that in South Africa. Firstly, let's get the president to stand up and speak for children. Secondly, let's start to talk about a branded program of action. And thirdly, let's build a mechanism that can really try and drive it. And so that was the thinking behind the development, firstly, of the national strategy to accelerate action for children, which has been approved by Cabinet on the 5th of December. And that national strategy identifies 10 priorities that the whole country needs to mobilize around. It also identifies 10 interventions that can make the most difference for children, some of which are not yet government policy, but it lists them as key interventions. So that was the first thing. Get the priorities in place, get the president to drive it. Now we needed a branded program, and while we don't yet have the level of buy-in from government to formally position Hold My Hand as the national program of action for children, we're mirroring that idea. We're sort of setting it up, not as a campaign that DGMT owns, but rather as a galvanizing a movement, a way in which everybody can get behind. Hold My Hand says our children to us, and that requires all of us. That requires all of us to get behind it. And then thirdly, through agreement with the presidency, DGMT has been designated as the sort of placeholder, the incubator of this accelerator, of this sort of agency for children. And we're driving it through Hold My Hand, but with the understanding that we're simply the node, hopefully, of a massive network of action that needs to involve a range, as I said, of business, civil society, and government departments across the country.
I think you've alluded to this already, but if you could maybe share a bit more about what would success look like if the campaign works. So you spoke about this network, civil society, businesses, any other comments on what success would look like for the campaign to work?
So let's be clear. I mean, our success must ultimately be measured in terms of the outcomes that we're trying to achieve. And so foregrounding issues of nutrition and end to stunting in South Africa. The president has spoken about an ending stunting by 2030. Obviously, it will take a while for the prevalence of stunting to work its way out because children are already stunted. But that's that's a very, very useful and clear target and goal from government. Another one, for example, is universal access to early learning programs for children. Clear goal: get every single child into a quality quality early learning program. Then for older children, sort of access to sexual and reproductive health services as part of a broader program of adolescent well-being. And there it must be measured in terms of continuing reductions in HIV rates, in access to contraceptives, reductions in teen pregnancy. So that's what we're after. And so the engagements that we're having with departments is really towards those outcomes. Now, what would success rate be look like in terms of this campaign? Would be if everybody found a place in this national movement, didn't see it as a DGMT initiative, but really got behind the intent of it, which is co-ownership of this movement for change in the country, where everybody can say, we're involved in elimination of stunting because we're focusing on sustainable food growth and access to markets. We see that as one of the key ways in which we're going to improve outcomes for children, and we see that as contributing to the Hold My Hand effort and finding ways to share what you are doing in that space with many others who are interested in saying, we're also trying to get food gardens going across the country. How do we do that? And sort of building this community of practice, this sort of open knowledge network that we're all part of, that can hopefully surface the collective effort of civil society, which is often hidden by government. Find a way of surfacing that and show that, in fact, there is a massive mobilization of effort and activities across the country being driven by civil society that is, in fact, being complementary, supportive, and sometimes right at the frontier of action for children.
Brilliant. So I think you've made it very clear that this is not just about funding more programs, but it is really about a systemic shift, and that it's not just up to one of the stakeholders or one of the actors, but really across all of South Africa's stakeholders, including government, private sector, NGOs, civil society, individuals, etc. So I'd love to get really practical and understand what are the different actions that are being expected or encouraged by the different stakeholders. So if we're talking about government, what is the specific responsibility of government in this campaign? Or what is government currently not doing that needs to change?
Yeah. So let me focus firstly on the 10 priorities of the national strategy, and then dive into some of the areas that I've spoken about. So it's absolutely critical that all of government, parliaments, premiers, local authorities understand what those 10 priorities are and their responsibilities with respect to that. So some of these are very sort of high level priorities. For example, the elimination of vertical transmission of HIV. That's really focused on the Department of Health. They've got to do that. But others, let's just take, for example, protecting children from all forms of injury and harm. Local government has a major role to play there. Both in terms of just basic services, water, sanitation, etc. But also, for example, in terms of liquor trading hours, whether it's open on a Sunday, DTIC, a responsibility in terms of the size of liquor containers, because we know that the larger the liquor containers, the more people drink. And so trying to identify for every single stakeholder in government the 2 or 3 major actions that they need to play. So we're coming up to local government election, and we'll certainly be really putting children at the center and saying the town of Stellenbosch, the city of Cape Town, how child-friendly are you? How committed are you to children? And this is the dashboard. This is the dashboard in terms of health, of education, protection against harm. So that's the first thing. And so we will be working over the next year to make sure that the premiers are held to account, the mayors are held to account by the president for specific priorities that have been identified. But then, we need to get really practical about how civil society can get involved. And let's
Mm.
just take sort of 5 areas that the accelerator, the Hold My Hand accelerator, is sort of focusing on. And we're focusing on them firstly because we see them as gaps. They sort of fall between the cracks between government departments. So nobody's really responsible for them, or they just haven't been, they haven't been put in place. So the big one, and we've been talking about, is closing the food gap. And really, there are three. As I said, there are really two reasons why we have such poor nutrition. One are the environmental factors that are resulting in leaky guts and kids just not able to absorb food, and the other is the lack of nutrients. And so let's just stick with the latter. That will only be addressed if we can make protein-rich staples more available, more accessible. Secondly, and more affordable. If we can stop our babies from being born small, and if they are, remediate them quickly. And third, if we can help families grow nutritious food. I mean, those are the three big things. So for those people that are listening today, I mean, you will see yourselves in one of those three areas that I've described. I mean, we have to make protein staples more affordable. That does require business to come to the table. That will only happen if everybody in South Africa believes that it is wrong for any child to be malnourished or even die of malnutrition in this country. That's the expectation that we should be having of the business sector, even as we seek to engage with it. Secondly, as I said, we've got to remediate children who've been born too small. Here we're working with the Western Cape government and with ShopRite to identify underweight pregnant women, mothers of low birth weight babies, provide food vouchers for them for the 10 Best Buy protein staples for 6 months. That must be supported by a massive promotion of the 10 Best Buys, or the 11 Best Buys. It doesn't matter. The 10's are not important. But civil society should be getting behind efforts like that and reinforcing in all of their work that these are the type of things, the beans, the legumes, the dairy products, the pilchards. These are the things that are protein dense and can really make a difference. Eggs, how can I forget eggs? Which are so critical, and so all of us need to get behind that sort of movement of promotion and engagement with community, and think about it. How do we make eggs more accessible in their communities? There's work that's been done in Kenya and other countries around this sort of idea of these egg hubs where local farmers, smallholder farmers, are contributing to large collectives that have significantly increased egg production in their communities. These are practical things that can be done, and that links to the third point around around growing food. And I understand the limitations of growing food in informal settlements, but I can tell you, just based on working with people and projects around South Africa, how much food can be produced if there's local mobilization. I mean, working in East London, for example, unemployed young people, we talk to them about HIV. They say that's fine, but we don't have jobs. We introduce them to local food production, nutritious foods. We link that to feeding their babies. And that's been one of the most successful. All of a sudden, we've got 30, 40 food gardens being established in that community. So thinking about how we now take all of those collective efforts around the country, focused on local food production, local supply chains, find a way to network those together, link it to extension services like has been done in eThekwini. So water tanks, fences come in, NGOs provide ongoing support, build that community of practice, link that community of practice to the next group of NGOs that are saying, what can we do? We don't know how to do it, but there are these experts that are there. That's the sort of knock-on effect that we need to create. I mean, the second area is early language development and learning, and very few people focusing on 0 to 3-year-olds. Just the power of language development in setting later life courses, and that's something that any civil society organization can do with the people that they're working with. If they're working with women in the field, those women are also mothers or fathers, and so there's the opportunity to bring that into their homes and into their lives. I've spoken about alcohol harm reduction, which really requires government policy and industry buy-in. And obviously, you're sitting in the wine industry, in a community, a wine growing community, and we still know today that not all, but some farmers are producing and selling wine with a label and then taking that label off and dumping it in poor community. That's got to stop. I mean, for the good of all of us, including those wine farmers. Hearing screening. Our children are not being screened at birth, so we're missing children with hearing loss. So working with government, obviously, and with parents as well, to fill that gap, to say this is a critical intervention that could be put in place, has been shown to be cost effective. And then lastly, a focus on teenagers. If teenagers are feeling dislocated, they're feeling marginalized, their sense of identity is sort of damaged. Who are they? What are they going to become? It's a sense of limbo, and we've got to regain that sense of purpose and belonging and identity. And that's softer, but it's equally critical if we're going to build the sort of social cohesion and this protective mesh around people in our society.
Mm-hmm. So I think what you've really outlined for me now is that it requires a holistic approach and a sort of multi-pronged approach. It's not just about looking at is there enough protein-rich food available that's accessible and affordable, but we're talking about looking at alcohol consumption. You talked about the importance of growing food, the housing challenges. So really these various factors that all influence whether a child can flourish later on in life. So I think what my takeaway is the importance of partnership in this. I don't think any single entity, whether that's an NGO or a business, can do this alone, and that we should be looking for partnerships in doing this together and unlocking something that wouldn't be possible if we did it alone.
We've got to hold hands. We got to hold hands with children, and we have to reach out and ask people to hold our hands. Absolutely. Mm-hmm. And I think part of the challenge we have is, because this is so multifaceted, is that people can feel hopeless. People can feel like, this is about water, it's about housing, it's about all of these. But there's always a frontier of possibility. There are always things that can be done. There are very practical things that can be done now to improve child nutrition. I mean, just a practical one in the health sector. It's been shown that giving moms 15 vitamins and minerals instead of in one tablet, multiple micronutrient supplementation, is more effective than iron and folates in reducing low birth weights, like 15% more effective. It's 1 in 6, but that's significant. That's going to cost maybe 1.5 times more than in folate, but the benefits to the country are so massive. So that's an easy one. Let's work with SAPRA, and we are. But let's work with SAPRA and get that accepted. We've made an incremental gain. Let's get the Western Cape government to work with ShopRite to really focus on the families that are at highest risk, those low birth weight babies. Let's intensify care, bring in community health worker support, and we should see gains there. So yes, this is a long path, but the interesting thing is that if you have a look at countries that have taken, for example, issues of nutritional stunting seriously, they've managed to halve stunting within 7 or 8 years. That's the sort of that's the sort of time frame. So very practical things, and I'm talking about areas in India, in Bangladesh, countries similar to us, where the same sort of issues of marginalization have been able to do it. Why can't we?
Hmm. And I think you've really touched on every single stakeholder or actor within society and given examples of government, private sector, NGOs, civil society. And I hope that everybody that is listening to this can really walk away from this conversation knowing that there is a role for me to play in this, and I can see a pathway into supporting the National Hold My Hand campaign. And also, as you know, I've shared with you a little bit the Robben Island Swim campaign that I'm doing. So at the Sustainability Institute, we're raising funds for the work that we do, as well as the Startwell Foundation, both of which work directly with children and nutrition. And I see this as a small but personal way of responding to the same crisis you're describing. I was a swimmer growing up, and I feel this is a lovely challenge to bring some awareness, I think, also amongst my personal networks. And I guess my question for you is, how important do you think is it that leaders in civil society not only advocate, but also personally commit?
Yeah. So the experience of a child is really the interaction between the child and certainly the mother, the father in the first instance, and it's those very profound relationships that serve and return that actually shapes the brain, builds the brain, and puts the child on a future trajectory. So I think what you're doing here is bringing us from the national into the home, and that interface between the child and a caregiver and a parent, and ultimately it is that nexus, it is that duo that is the most profound influence in the child's life. And the one group that I didn't mention are trade unions, but workers are parents too, or uncles or aunts, and so even as we're addressing trade unions, we can tug at people's hearts by just relating to their children in their lives. And it is the experience of our children today that is going to shape the future of South Africa in 15, 20 years' time. It's their experience. And so it does come down to each one of us. It does come down to leadership, not only to make the bold decisions, actually say there's got to be policy in place around, for example, prevention of heavy drinking in communities. That's a very bold political move that needs to be made. But at the same time, each of those leaders has to take it back into her or his or their communities and into their homes, and ensure that what we've talked about now, the protection of the child during pregnancy, that important interface and developing language and learning and exchange and stimulation in the first year of life, trying to ensure then that the children is able to socialize with other children and into early learning programs. It's that very basic scaffolding of a child's life that is each and every one of our responsibility.
David, I want to say thank you so much for sharing all of your knowledge and insight with us. And if you had to leave South Africans with one sentence today about why this campaign matters, what would you say?
Imagine if every child born today, tomorrow, the next day, and the next had enough love, enough food, enough safety, and enough brain power today, tomorrow, the next day, and the next. We would change our future.
Thank you. A wonderful call to action. Thank you so much, David.
Thank you, Vanessa.